Hi, I'm Miss Spalding and I'm going to walk you through how to give a newborn IM injection today. This baby has been delivered and is ready for its shots. Okay, the first step is we're going to verify our orders. This is a paper copy of what the EMR is going to look like. So you'll pull up the chart and make sure that the vitamin K, erythromycin, and hepatitis B have all been ordered. We are going to get a verbal confirmation that the parents are okay with the erythromycin and vitamin K. Hepatitis B is going to need a signed paper consent at most hospitals. Check with the hospital policy because some want a signed declination form. Therefore, they would only need a verbal consent. So be sure to check what your hospital policy is regarding the hepatitis B consent form. Okay. Today, this baby has already had its vitamin K shot, and so we are just going to give the hepatitis B vaccine. I have my paper copy of the signed consent form, so I know that the parents are okay with this hepatitis B vaccine. I'm going to then explain the medication that I'm giving to them. But the second thing I want to do is go back through the MAR and see which leg the vitamin K shot has been given, because we want to give the hepatitis B vaccine in the opposite leg so that we're not giving both shots in the same leg. Some hepatitis B vaccines will come in a vial like this, where you have to draw up the solution, and some are already pre-filled. Make sure that you are using the correct needle gauge and size. For a newborn IM injection, we only use 25 gauge 5/8 inch needles. To properly identify the infant, since they cannot state their name and date of birth, we are going to have to check their armband and compare it to the MAR, their name, date of birth, and MRN number. The injection site for newborn IM injection is going to be the vastus lateralis. To correctly identify this site, you need to find the landmarks of the greater trochanter and the patella. The vastus lateralis is going to run in between those sites. In order to find the greater trochanter, you must first remove the diaper to localize it. So a little trick that I do, I put a finger on the greater trochanter, which is on the lateral side of the leg, and I put a finger on the patella, which is on the anterior side of the leg, and I have them meet in the middle, which is the anterolateral side of the leg, which is where the vastus lateralis is. You can see on this injection mannequin that the injection pad is not quite on that vastus lateralis. This is more anterior on the leg, which is not where we want to give the injection. So after we locate the injection site, we are then going to talk about how to stabilize this leg. With babies, we can't just tell them to lay still while we give them an injection. So I'm going to teach you the proper technique on how to hold the leg and stabilize it before giving the injection. I'm going to take my non-dominant hand, take the pinky finger until the middle finger, the 3 fingers, and put that underneath the knee. I'm then going to put the heel of my hand and press down on that patella to press that leg to the table. With my pointer finger and my thumb, I'm then going to make a V where I located that site. This is to, 1, help me visualize where that injection site was, and then 2, to be able to press down and stabilize this leg while I give the injection with my other hand. So I'm going to put my gloves on. I've identified my baby. I have made sure this is the correct medication. I've scanned it in. Everything is done. I've removed the diaper to locate my vastus lateralis. Take my 3 fingers, put it under the knee. Put my thumb and pointer finger in a V shape to mark my site. I'm then going to take my alcohol pad and wipe. ask my CI to remove the lid of the needle. I will go ahead and this needle in one time, give the medication, withdraw the needle, activate the safety, and then I would put a 2x2 until I can get the Band-Aid. We just use the little circle Band-Aids for the injection sites, okay? And I'll put the diaper on and this baby is good to go. No rubbing on that site. You don't want to go in this room and act like this is your first baby IM injection. It's going to make you nervous, it's going to make the parents nervous, and whatever you do, just practice ahead of time to have a little confidence so you're not going in there shaking this needle all the way in. The reason we don't want your finger on this plunger is because your nerves are going and you're focusing so hard on this injection site that meanwhile this medicine is squirting out of this syringe as you're making your way to inject the baby. So if you have any questions with this, feel free to ask us. Your CI will communicate their preferences with you. What we're going over today is newborn IM injection specific. Still follow the Wake Tech 3 checks for medication administration all the way through. Washing your hands, donning gloves, scanning the medications, you know, all before giving the medication. So just remember that while you're watching this video.